I'd like to welcome everybody to the June 3rd, 2025 Health and Human Services Committee meeting. Attendance has been taken. I appreciate all the supervisors for making it today. Supervisor Thompson is excused. I heard that Public Works, which comes up at 3:30, is canceled today, so we've got a full hour to for our meeting.
I gotta go.
Motion to adjourn. No chance. All right. Next item, approval of the minutes from our May 6, 2025 meeting. Copies of those minutes have been distributed to supervisors for review. Do I have a motion to approve those minutes as drafted?
So moved.
Motion made. Do I have a second? Second. Any questions on those? Hearing none, all in favor say aye.
Aye.
Opposed? Ayes have it. Next, we've got Megan Johnson from Mental Health and Addiction with a number of items. Megan, come on up. We'll take these one at a time. I think we're going to be voting on the first three items I should go over.
Yes. So thank you all for having us here. The first item of our three is a resolution to accept PROS viability funding in the amount of $49,335 that has been issued to Saratoga County in support of some redesign. So the New York State Office of Mental Health promulgated some new guidelines and regulations effective April 1st, 2025 for our PROS program. And I can just give a very brief, one sentence about what PROS is in a moment. The redesign, again, became effective April 1st. This funding, which was allocated to every PROS program around the state to support that redesign, can be used for operational costs, workforce costs, materials, supplies to kind of help align with the new regulations. So our PROS program is one of the programs that we operate directly. Our staff provides to the residents of Saratoga County out of our building. And it is not a treatment program like our others. It is really a rehab and recovery focused program where individuals who have very specific life goals, work, education, a new or different housing situation, transitions from homelessness to housing, building of natural supports. So in the community, whether that be churches or volunteering or whatever they may be, work with vocational counselors, mental health counselors, and other substance abuse counselors to move towards those goals. And it's a kind of individual focus as well as a group-based curriculum program. And so the redesign is intended to kind of rebalance towards more individual outreach and also getting out in the community. So of the $49,335, I think there is a fraction of that, about half, close to half, that will go to fund balance, $23,791 rather, and the remainder will go towards materials and supplies and some enhancements in our setting.
Okay. I said one question. Why the difference between what goes to fund balance and what's being used for the program? Is there going to be unused funds that becomes part of our fund balance for future funds?
Yeah, we just looked at what we really needed, what we thought was necessary to kind of help promote the client activities and what they needed to help. We're very focused. They are very focused on employment. So there is some enhancements around client workstations in our setting and kind of moving. We really looked at the minimum that we needed to kind of help align with these regulations.
But if we don't, so the grant funding is for $49,000.
The remainder can go into just operational funding to help support workforce costs.
Oh, okay. So it goes into labor costs.
Yes.
Okay. Any other questions for Ms. Johnson?
I'll make that motion, Chairman.
Motion made. Do I have a second? Sorry. All in favor, say aye.
Aye.
Opposed? Ayes have it. Thank you, Megan. Next one.
So the next two are very similar, just different agencies. So this request is to authorize a contract with Parsons Child and Family Center. Which one's first on your agenda? Sorry. Parsons first?
Yeah, Parsons is first. Yeah.
Thank you. Authorize a contract with Parsons to pass through funding in the amount of $112,528 and to amend the 2025 budget. So this funding is what's called school-based mental health satellite clinic enhancement funding. was actually an initial allocation out of the 2022-2023 funding years from the State Office of Mental Health. It was discovered that we had not passed this through until very recently, and so we want to get this money to these agencies at this time. The funding is per site for each of these agencies. Parsons Child and Family Center operates, they contract with 4 school districts in our county, and they have 13 sites at which they offer mental health services directly in the schools. These enhancement funds are intended to kind of help offset the costs that are not insurance reimbursable for those programs. So like supplies and materials for the clinicians who are in the schools, the time that they spend coordinating with the Committee on Special Education or with teachers, retention, recruitment fees, those sorts of things, or recruitment costs rather. So for Parsons, it is a total of $112,528.
Okay, so do I have a motion to approve the authorization for an agreement with Parsons Child and Family Center for school-based mental health satellite clinic enhancement, ending the 2025 county budget in relation to their motion?
I'll do that.
Motion made. Do I have a second? Seconded. Any other questions for Ms. Johnson? All right, hearing none. All in favor, say aye.
Aye.
Opposed? Ayes have it. Thanks.
Thank you all.
Third.
Yeah, so the third one is very similar to the second. It is for Behavioral Health Services North, though, as the provider of these services. So BHSN, as it is sometimes referred to, is actually a clinic that is based in Queensbury, and they have a contract to provide these school-based mental health services in the Saratoga Springs School District. So they do that at 8 sites within the Saratoga City District. Their funding allocation, or our request, is to authorize a contract with BHSN to pass through this funding in the amount of $69,248 and to amend the 2025 budget.
Thank you. Do I have a motion to move forward with the authorization of this agreement? Hey, do I have a second? Seconded. Any questions? Hearing none, all in favor say aye.
Aye.
Opposed? Ayes have it. And lastly, under Ms. Johnson, she had a new recent addition to her team.
Do.
We want to welcome Ms. Townsend
Yes.
to do an introduction and tell us about yourself and your role.
Yes, I'm so pleased to introduce Ashley Townsend, who has recently started as our new Deputy Commissioner in the Department of Mental Health and Addiction Services. Ashley just started May 19th, so this is her second week with us here, and luckily got to have like the staff picnic in her second week and all kinds of good things.
Well, thanks, Megan, and thank you for having me. I'm really glad to be back with Saratoga County. So I have about 19 years of experience primarily in community mental health in Warren, Washington, and Saratoga counties. Started in Warren, Washington counties, and my history with Saratoga County actually goes back to 2011. I was in Friendship House, which was the precursor to the PROS program that Megan was just talking about. And then I've been back as an employee a few times. I worked in the mental health clinic as a therapist. And then I was here from 2018 to 2021 as the coordinator of the mental health clinic. And I can't stop coming back. I'm really, really pleased to be here. I think that, Saratoga County is very blessed to have the array of services that it does, and also the support of you all in keeping those going. We're uniquely, I think, able to provide a lot of great services to our community. And it's just a wonderful, wonderful place to be a part of.
Well, welcome back.
Thank you so much.
Right. Yep.
Stick around for a while.
Yeah.
And thanks for coming and joining us with us today and introducing yourself to us. Great, thank you. All right, next we've got Commissioner Maxwell accepting the 2024-2025 John H. Chaffee Foster Care Program for Successful Transition to Adulthood Independent Living Allocation from the New York State Office of Children and Family Services and amending the 2025 county budget in relation thereto.
Sure. Good afternoon, Mr. Chairman and committee members. You just read the resolution that I need. I can read it again for the record if you
No need. Tell us what it is.
Yes, it authorizes the acceptance of the allocation $25,905 from OCFS to assist former and current foster care children to achieve self-sufficiency. It's an independent living program, so when they get to a certain age, whether they are going to be transitioning from foster care to independent living, or deemed to be at that age, transitioning to independent living. We provide them with independent living skills training, and they also get a stipend to go along with it so that they can do budgeting, practice budgeting, or managing their own money. The resolution will authorize myself as the commissioner and the chairman of the board to sign any documents to accept the funds. And it will share anything that requires the county attorney gets to him for review and approval prior to those signing that. Why this comes about is that each year we get an allocation dating back to the late 90s. And the social service budget is usually predicated when we do it, like this July, we'll start working on it, predicated on the current budget. And last year, we had $24,831. So when the new allocation came out, we had an additional $1,074. And so that's why I need a budget amendment along with this resolution.
I'll make that motion.
So the difference was because of the state just issuing their budget for the fiscal.
Yes, and then we just get, this is it's federal allocation. So the federal budget usually works in October.
Okay.
And the state goes through its budget process to accept that money, and then we get it, and then we go back and claim any expenditures that we've incurred. And these are mandated expenditures, but we never know exactly what the feds are going to do or the state's going to do with the distribution.
Thank you. All right, so I have a motion made by Supervisor Lang. I have a second. Any questions for Commissioner on this one? All right, hearing none, all in favor say aye.
Aye.
Opposed? Ayes have it. Thank you.
Thank you.
So Commissioner, if you could just come back up. So at last week's picnic, there were a number of employees with different years of service at Saratoga County, and Commissioner Maxwell was one of those recognized.
You got the grand prize.
And he got the grand prize for 40 years of service
An
with
extra hamburger.
Saratoga County. So I would like to personally present Commissioner Maxwell with a 40 years of service pin, acknowledging his commitment to Saratoga County through the years. And I do promise that when you hit 50, the pin will be a little bit bigger. So I'm looking forward to that. Hopefully I'm still around. I'm sure you'll still be around. Thank you.
Thank you.
Yeah, Joe.
All right, any other business to come before the committee? See what you get to look forward to, Ashley. Hearing none, do I have a motion to adjourn?
Yeah.
Motion made. Do I have a second? Second. All in favor, say aye.
Aye.
Opposed? Ayes have it. Thanks, everyone.
Thank you, Chairman.